Θα ήθελα τώρα να περάσουμε στην επόμενη ενότητα με τίτλο The US Food Industry Spotlight on the Mediterranean Diet and Health Trend και θα ήθελα να δώσω το λόγο στην κυρία Ελευθερία Davatzi. Eleftheria, hello. Eleftheria has studied sociology and mass media sociology at Padyan University. She has been working as a journalist for the past 13 years, and for the past 2 years, she is working as a journalist for the World News and International Affairs for Mega TV. Eleftheria, thank you for being here with us today, and the floor is yours.
Thank you. I am really happy to be part of the 6th Export USA Forum. As you said before, Dina, our topic is the US food industry spotlight on the Mediterranean diet and health trend. And Mr. Tassos Kyriakides is the one who's going to elaborate on this subject. Hello, Mr. Kyriakides. Let me say some things before I give you the cyber floor, since we do this forum through the internet. Mr. Kyriakides has completed his bachelor in biochemistry as a Fulbright scholar at UCLA and received his Ph.D. in epidemiology from the Yale School of Public Health. The floor is yours, Mr. Kyriakides. We are all ears to hear the interesting speech of yours.
Thank you. Eleftheria, and thank you to the American Hellenic Chamber of Commerce for giving me this opportunity to step out of my academic environment and talk to a group like this. I think it's the first time I'm giving such a presentation to a group like this, with the idea that I'm going to share some of the things I've been working on the last 15 years. But at the same time, I'm looking forward to learning more on what the other side is doing when it comes to nutrition and health. I'll take you back in the late 50s, early 1960s, when a physician from the US, Ansel Keys, started the what's known as the 7-country study. And basically it was an attempt to look at what is the impact of nutrition and lifestyle on health. And primarily he was looking at cardiovascular health. And there's a lot of information and evidence that came from that study, but I'll focus on one slide that I think tells a whole story when we start thinking about food and nutrition as it pertains to our part of the world, the Mediterranean. If you can look at the slide on the right, there's this red line that's drawn where the extraordinary finding that people in Crete, even though they were consuming the same amount of, in terms of calories coming from fat of 40%, were almost, they had no coronary deaths per 10,000 was the metric that they were looking at, as opposed to East Finland, the same proportion of calories from fat, but yet their cardiovascular impact was much, much higher. So then started the questioning, why is that the case? And long story short, a lot of years later, it was identified that the main reason for that is the way people in Crete eat. And what they eat, with the main pillar of their nutrition being olive oil. So most of their calories from fat was coming from what we now know is a very healthy food, olive oil. And that is at the heart of the Mediterranean nutrition. We all live and enjoy this kind of nutrition. How do we introduce that or increase the consumption of such a paradigm within the US? And it's no secret that this diet, nutrition, however you want to call it, I try to avoid using the word diet because sometimes it has a negative connotation. It's like we're deprived of something. I don't think those who eat the Mediterranean kind of food can say I was deprived of this food or the other. But that's a side note. But the last 4 years, the US News declared this kind of nutrition is the best overall, even as recently as 2021, and best in these 5 categories: healthy eating, easy to follow, best for diabetes, heart healthy, and plant-based. So, but I want to take it a step further and say that this is not news to any of us who agree with it or who consume this kind of nutrition. This has been around for thousands of years, this kind of the way of eating that we call Mediterranean, as opposed to other diets that come and go. You know, it's this diet this year and then 2 years later it's gone. But Mediterranean nutrition has stood the test of time. So the question now is, how do we take that and increase its consumption? There's varying estimates of adherence to Mediterranean nutrition, at least in the US. It's not quite clear how to capture that information, but let's assume that there's a range of estimates anywhere from 5% based on some online surveys all the way to about 47%, closely following that Mediterranean nutrition paradigm, with the East Coast and the West Coast of the US most likely, as of data from 2018, that shows that those are the two areas in the country that are mostly following that, which kind of makes sense. I think building on what previous speakers said, there's this increase in awareness about this, and you have younger populations, and populations are residing on those two coasts, and it's much easier to introduce this and expand on the consumption of Mediterranean foods. But I want to spend a couple of minutes on the evidence behind why is Mediterranean nutrition good for us. And maybe at some point we have to think a little bit differently, because we've been, the last 60 or so years, a lot of evidence has accumulated, and preaching and saying, well, it's healthy for you, at some point people might get tired of that. Maybe we should think of flipping changing the narrative and saying it's actually very tasty. And by the way, it's good for your health. But that's a different topic for conversation. So the evidence that we've accumulated the last 60 years, and I know there's going to be a lot more coming in the near future, focuses on 5 main areas of human health: cardiovascular and coronary. That was the beginning, going back to the 7-country study. And today, obviously, there's more recently the Predimed study out of Spain, verified the findings of all this work that has happened the last 5-6 decades. Obviously, cancer is another area that there's a lot of evidence to suggest that this kind of food, this kind of consumption of healthy food has a positive impact. Cognitive neurological conditions, a lot of work now in Alzheimer's to show that consumption of foods that fall into the Mediterranean nutrition is beneficial for you, not only for treating, but also for preventing a lot of these conditions. Diabetes and endocrine metabolomic syndrome. I'm not going to spend time going through a quick pulling of references. I pulled together about 115 or so citations and papers that I've went through in creating a summary and sort of a synthesis of the evidence. But this slide, let the record show that it reflects more than about 100 or so citations in the literature. But if anybody wants to look at some of the synthesized work, there's 7 or 8 publications that summarize and reviews where the benefits are coming from and what are they. And there's direct benefits and indirect benefits. And again, I want to, the reason I'm focusing on olive oil and other olive tree products is because it's the main pillar of Mediterranean nutrition. Again, going back to that 7-country study where 40% of the fat intake, of the calories from fat coming from olive oil in the populations in Crete back in the late 50s, early 60s. So there's a lot of evidence, and it's not, we're just trying to push this, but there's evidence to support that it's good for your health. Now, as some of you might know, olive oil is one of the few food products or food items that has secured a health claim from the European Food Safety Authority back in 2012. And the evidence that was used for that was the ability of these compounds in olive oil to protect blood lipids from oxidative stress. And as the evidence has shown, oxidative stress is something that downstream causes cardiovascular health issues. So you have a product that you're using as part of your nutrition that prevents the lipids, your high density lipoprotein and your low density lipoprotein from becoming oxidized, and that's what causes atherosclerosis and sort of the downstream negative side effects. So that's a claim that is there for olive oil to hold. And at the same time, the USDA, the United States Department of Agriculture, has similar, and the FDA has similar claims, more on the sort of hinging on the cardiovascular, not just the oxidative stress of blood lipids. where do I see we should be heading? And I think it was alluded before. We need to figure out a way, being creative, on how do we increase availability and the demand in the U.S. Should we be targeting different age groups? And I can tell you from work we're doing here at the university, we've been able to increase the consumption of olive oil, as an example, from about 1 liter per person per year, which is the U.S. average, to about 7 in 6 years. So we almost a 700% increase by targeting the nutrition that we give to our students here. I want to see that go to younger populations, because younger kids, grade school, 7, 10 years old, are just exploring their palate, and they have to be exposed to foods that will downstream help them in their health. At the same time, we have to think how to ensure sustainability, because if we increase the demand, we have to meet it with enough supply. And at the same time, we have to be cognizant of our environment. What are the planetary health implications? And I think this pandemic has raised the awareness of what are we to do going forward once we're clear from this pandemic. And obviously have to talk about production of food and how we ensure that we have a healthy food combination, but how do we make sure that the risk or the impact, positive impact, is not causing any downstream negative implications on our planet. And just recent evidence, 1 liter, if you look at the production of 1 liter of olive oil, it can offset about 23 pounds of carbon dioxide from the atmosphere. Olive trees are a carbon sink. So we have something that is healthy and something that can give you a positive impact on the carbon, on the footprint. There's a lot of areas that we're expanding on and we're starting to look at now. The gut microbiome is an area of health that a lot of people are paying attention. We know there's something there that we have not tapped into. And we have a lot of, for example, GI issues becoming more prevalent in the US, and we're seeing people shifting to a gluten-free diet, which are new things that we're seeing that we didn't have years ago, but there's something in the gut microbiome that maybe we should start looking into, and how does the Mediterranean nutrition impact in a positive way the microbiome to sustain its health and therefore have a human health positive implications. And also bone health is something that is yet to be explored. Are there going to be new health claims? Probably. Just like we have olive oil, there's some work that's starting now with table olives. I would not be surprised if we have a lot of the herbs that we use and the spices that we use in the Mediterranean nutrition that will be discovered as having some health implications that could sustain the claim for a health label. And there might be others that I think we're exploding now in terms of ideas of where to look for, and with technology increasing rapidly, how do we harness that in achieving that that path forward? And part of that is coming under what we're starting here at our School of Public Health to establish a Knowledge Sciences and Health Institute that we're trying to become the the interface and the catalyst between the U.S. and other organizations, both academic, non-academic, and industry, to look at how do we approach systematically the study, the research, and the creative thinking about how do we promote this healthy food, but also healthy lifestyle that incorporates Mediterranean nutrition. And we've done a lot of work in engaging people from different parts of the spectrum. And again, even myself speaking here on this forum is an indication that we need to break down those walls that, oh, we're academia, we don't talk to industry. But I know there's a lot of creative minds, more creative than I am, on this forum, where we can think of how we can package things and how we can provide things, making more appealing to people in the US to understand that this is something that is tasty, it's good for you, and it's something that will sustain you both in terms of your own health, but also in the the planetary health implications. And just a little PR here, as part of that initiative, we have our 3rd symposium that happens in every year, with the exception of last year because it was canceled due to the pandemic. We're going to Jaén to co-host the event with the University of Jaén focusing on a lot of areas, including sort of the science, but also nutrition and health, agronomy, obviously, agriculture, sustainable agriculture, and without gastronomy and culture, and without the industry that produces these products, whether it's olive oil or olives or whatever have you in the Mediterranean nutrition, we wouldn't be able to do all the work that we're doing. So I'll close with that, and if anybody's interested, I can provide more information on this. Thank you.
Thank you very much. You were explaining. So you mentioned starting that Mediterranean diet was declared the best diet for people. But I would like to ask, how popular is the diet in the US, and do Greek products have a competitive advantage indeed?
I think, like I said before, the data is not very clear, but I will take sort of an estimate of what I've seen, about anywhere from 5 to 30, 40% of people adhering to the Mediterranean diet. I think we have a lot of potential to increase that, and maybe I'm biased because I'm Greek, but I can say that we are very creative when it comes to food, and that's something we need to export in this country. Bring it here, because people are thirsty for something new, something that has history, something that will help them in sort of viewing food as not just consumption of calories. I think we need to make that shift, that we're not just consuming calories, we're enjoying what we're eating, and at the same time, we're getting something healthy out of it. So I think even if we take the 30, 40%, we still have room to grow in terms of introducing the Mediterranean diet in this country.
What do you think should be done for the Mediterranean diet to be introduced? Which way would be the best?
To me, it's a lot of education, and that's one of our pillars here in our institution and other institutions. We're partnering with other universities in the U.S. in promoting the Mediterranean nutrition, a very plant-based approach to eating. And there's partnerships with major institutions. And I'm thinking, if we have, let's say, from our university, 1,500 students graduating every year who've been exposed to this kind of nutrition, even if half of them, even if 30% of them go out in the U.S. market and look for these things, that will create the interest. But I want to go back earlier in somebody's schooling career. I want to go into the elementary school. I want to teach the kids, this is, try this, expose them to different things, because guess what? If your kid comes home and says, I had this at school today, or I tasted this, I want to get it. I don't think there's a parent who's going to say, no, we're not going to buy it. Those of you who have kids can appreciate this. And that creates that new market. I think I was talking before. Let's target younger populations, younger age groups, in order to, because that's the future of where this product will be absorbed.
And we should need from you some advice for the producers. What are the steps that the producer or standardization packaging facility should follow in order for their products to be qualified as eligible for a claim?
So I'll be very honest and transparent. I've been to most of the Mediterranean countries and working on this and talking to people. I can say without any hesitation that the creativity that I see in the food products in Greece surpasses anything I've seen. And how do we bring it here? How do we appeal, let's say, to an 8-year-old? I'm sure there's very creative minds in the marketing departments in a lot of our companies in Greece who can think of how do we make it attractive to an 8-year-old to grab the bottle of olive oil or take the product that's sitting on the shelf because it's appealing to them. That would be a very big strength. And again, I've seen it there in Greece. Why can't we bring it here? So I'll let those creative minds have their juices start flowing and how we make it appealing. And I think the other thing we have to add, and my recommendation is tie the story behind the product, because people here like hearing the story. Where is this coming from? Why is it packaged this way? Why is it produced this way, the way it's produced? So give them the story behind it, and they will just enjoy it even more, because now they can connect with the product, and it's not just something that they buy in a box or in a bottle. It's something that has history behind it, And how do we transmit that message on the real estate of a box, let's say? How do we make that very clear that this is not just olives? It's olives coming from this part, packaged this way and produced this way, and that's the history. I think that building that narrative will definitely help promote products like this in this country.
And a last question, if we don't have any other questions. You mentioned olive oil. You've also mentioned herbs during your presentation. Is there any other product that you think that should follow the claims process, such as honey, let's say, cheese?
I think teas are going to be, we have a lot of amazing teas with a lot of antioxidant properties. And I think that's the next sort of frontier, if you will, in looking for health claims. I mean, again, I go back to the history of this. We've been doing it. Our grandparents were doing it. Their grandparents were doing it. We know there's something there. Now we have to just generate the evidence to support that health claim. And I think teas and the teas that we have from any part of Greece you go, there's going to be some form of tea or herb you can use. And I think we have the technology now to look into that and attach a health claim that will make it even more appealing. And I'm not naive to the fact that the market here, if they hear, okay, here's a product that has a health claim because of it's antioxidant, it's anti this, it's anti that, people will be more inclined to buy that as opposed to something that doesn't have it.
Thank you very much, Mr. Kyriakides. It was an honor talking with you. I think that now we should go back to Dina, so as the forum to proceed with the next speakers.
Σας ευχαριστώ πάρα πολύ και την κυρία Davatzi και τον Professor Τάσο Κυριακίδη για την πολύ ωραία συζήτηση που είχαν. Εγώ αυτό που συγκράτησα είναι ότι τα health claims μπορούν όντως να χρησιμοποιηθούν σαν marketing tools για τις ελληνικές εξαγωγικές επιχειρήσεις, καθώς επίσης και την αξία και τη σημασία που έχει το storytelling και σε αυτό τα ελληνικά προϊόντα έχουν ένα προτέρημα.